Hi everyone, we're going to talk a little bit about Botox or toxin today, which is also known as a neuromodulator. There are 4 types. There is Botox, there's Dysport, there's Xeomin, and there's Jeuveau, also known as Newtox. It's the newest to the market. So Brittany, when did you start doing Botox?
So I would say that I started probably when I was 25. I wanted to get ready before my wedding. I think a lot of times people think that, you're too young to do it. But I really do find that it helps be preventative. I would say I started with Dysport because I was kind of afraid, like Dysport and Newtox are kind of one and the same in regards to like their softer approach. And I would say I started with that because I was kind of nervous with Botox, but now I just like them all.
Yeah, I actually started at 25 too. However, I just did it once, did it again at 27, and then waited a while, and I wasn't regular until I was 32. When did you start becoming regular, like staying every 3 to 4 months?
No, I was hooked on the look for sure. I was pretty regular, I would say. Yeah, I would say.
Since 25?
Yeah.
Those are some goals. What is your pain level when you get Botox?
Pain? I don't think it really is painful. The needle is really, really thin. I think there's a common misconception, like shots and vaccines, stuff like that, like freak me out, and that because they're kind of thicker, but I don't think it hurts, and it's so quick.
Yeah, for sure. I would say I would give a level of like a 1 to a 3 for my pain level. Again, though, I feel like I just have to say it's something because obviously you can feel it. But it's very
like 1 being the
tolerable.
least.
Yeah.
Yeah. I would say the same too. It's just kind of just a weird sensation rather than pain. I don't think so.
Yeah. The first time I got it, the first 2 times I got it, I was super, super nervous. I remember they said, "Do you want a numbing cream on your forehead for my second time?" And I was like, "Oh yes, I want it." And that night I had like the worst headache. I wasn't sure if it was because of the Botox or because of the numbing, but I do hear from my patients that they do say that headache the night of getting their treatment can happen, and you can take Tylenol for that.
Yeah.
Have you ever had any side effects from Botox?
I would say a headache once in a while. I mean, if I get a ton of units in my forehead, then I feel like that's when I would probably get a headache, but normally I would say I don't.
Yeah. Where do you get Botox? Or any of the toxins?
So I started always with my forehead, and so I treat that, and then recently just started treating this. I never really make that angry face, but I do find sometimes when you treat one area, kind of like this has to overcompensate sometimes. So
right.
I started getting this treated, and then did we do my eyes?
I think we did it one time.
Oh yeah.
You don't really have crow's feet.
Yeah.
But I'll just go through some of the other places you can get it. So you get it in your forehead and your glabella, which is like the 11s. You can get it around your eyes for the crow's feet. You can get it on your nose for the bunny lines when you scrunch up. You can get it above your lips, which is a lip flip. It rolls out the lips, so it kind of gives the more of a pink show. So it kind of gives the illusion that your lips are a little bigger.
I've done that.
Mm-hmm. You can treat the DAOs, which is the muscle that turns a smile down. So it's preventative. I do that one preventative just to help with the marionette lines that I don't ever want to get. Also treat the chin. It helps with like the orange peel appearance that people get as they age. You can also treat platysmal bands, which are the vertical bands that are in the neck. You also can do micro Botox for the crow's feet that kind of come all the way down into the cheek. Same thing with the chest or décolleté.
Yeah.
One other question. Biggest advice that you can give someone? I can go with mine first. Chasing symmetry. Obviously, symmetry is ideal. However, every face that I've encountered is asymmetric, and that's just how it is. There's always a bigger half and a smaller half of your face. So obviously, we're trying to get as close to symmetric as possible, but it's never going to be like that because there's always a stronger muscle pull on one side versus the other.
I would say probably my advice would be not waiting so long. I mean, I'm an esthetician, and I find that almost always in all procedures, people like to wait too long, and then you're kind of undoing a lot. So I do think that it is smart to do it not necessarily at a super young age, but once you start noticing them and they do start bothering you, because I do think that it is preventative, and I would say probably that would be my biggest advice.
That's great advice, actually. Thank you.
Happy juice?
Happy juice.
Say it louder.
Happy juice.
So happy juice!
Happy juice.
Is this Mama's happy juice?
Happy juice.